All right, so we're going to perform the head thrust test. So in order to do this test, we're going to flex the head about 30 degrees, and then we're going to have the patient maintain their eyes on the therapist's nose. So the whole time I want you to stay looking at my nose, okay? So just go ahead and relax and let me move you. So we're just going to slowly rotate the patient back and forth. And then we're going to give a quick jerk back to the neutral. And then we'll do that again. All right, so basically with the thrust, when we thrust back to neutral, we're testing that side. So when I bring the patient's head to the left, and then when we thrust it back to the right, we're testing the right ear. And when we bring it to the right and thrust it back to the left, we're testing the left ear. So basically the whole time we're looking at the eyes for any corrections or no corrections. So if the patient doesn't maintain on their eyes on my nose and there's no correction for the saccadic movements, then it's a central pathology, but if there is a saccadic correction, then it's a peripheral problem.
Go.
All right, next we're going to do the Dix-Hallpike for the posterior canal. So basically when we do the Dix-Hallpike, we're going to rotate the head to 45 degrees to the side we want to test, and then we're also going to bring the head into 30 degrees of extension. So on the patient here, if we want to test the right side, we're going to rotate the head 45 degrees, and obviously I would use a mat table, but I don't have access to one, and you always want to be on the side that you're testing, and then we're going to just bring the head back 30 degrees. So you're just going to instruct the patient that we're going to lay down and just let me move you, and you're supposed to do it as quickly as possible, but in this case, we're just going to go slow so we don't hit our head or anything. So we're going to bring the patient back, maintaining that 45 degrees and the 30 degrees extension, and then keep your eyes on my nose the entire time. So while doing this, you're looking for nystagmus in the eyes. So the typical pattern is going to be an upbeat torsional nystagmus towards the ear being affected. So that would mean on this case that he'd have nystagmus going towards the right side, which would indicate a posterior canal problem on the right ear. And so basically it takes about 5 to 20 seconds for nystagmus to kick in, and it shouldn't last any longer than 60 seconds. And then once the nystagmus stops, the patient might experience nausea or vomiting, so you want to have a trash can available just in case that happens. So you wait for the nystagmus to stop, and then you're just going to bring the patient back up.
Go.
All right, so now we're going to do the modified Epley's maneuver, and this is treatment for posterior BPPV, which can be found after the Dix-Hallpike results. So basically, it's going to be the same position as the Dix-Hallpike was. So if we're going to treat the right side of the patient or rotate the patient's head 45 degrees to the right, same thing with the extension, 30 degrees of extension. So we're going to rotate head 45, extend, and then we're going to have the patient lay back as quickly as possible, just like with the Dix-Hallpike. Maintain your eyes on my nose the whole time. So same thing, you want to check for nystagmus, just as I talked about in the last video. And then you're going to hold this position for twice as long as symptoms are lasting. So if the symptoms are 30 seconds, you'll hold for another 30 seconds. So once the nystagmus stops, we're going to then rotate the patient's head 90 degrees. So that way it's 45 degrees the opposite direction. And then we're going to hold again for twice as long as the symptoms last. So once that happens, we'll then instruct the patient to go ahead and roll on this side, okay? And then we're going to keep the head in that 45 degrees. And we wait 2 times as long as symptoms are again. And then when this is over, the patient can go ahead and sit up. All right, now we're going to do the supine roll test, and this is to test for horizontal canal BPPV. So we're going to have the patient supine, and then the head should be flexed about like 15 to 20 degrees. And you're just going to rotate the patient's head to the right and then to the left and neutral in the middle. So the whole time, again, you're going to look for the nystagmus, and it would just be a horizontal nystagmus. So we're just going to make sure the patient's about 20 degrees, and then we're going to quickly rotate the head. And the whole time you should maintain your eyes on my nose, okay? So you're going to look for nystagmus, and once again, it usually takes about 5 to 20 seconds for the nystagmus to kick in and shouldn't last any longer than 60 seconds. If there is no nystagmus, we'll bring the patient back to neutral, and we'll check the other side. So same thing, maintain your gaze on my nose the whole time. And you're, once again, just looking for nystagmus. Okay, there are two different types of horizontal nystagmus you could have. You could have geotrophic, which is when the nystagmus is beating down towards the earth. This is the most common kind, is you'll get more intense nystagmus on the side that's affected, or you can have the apogotrophic, which is when nystagmus is beating upwards, but this is a less common problem, and nystagmus will be equal on both sides. Last up is the Gaffani maneuver, which is to treat horizontal BPPV. So basically, you're going to have the patient starting sitting over the edge of the mat, just like this, and then you're going to bring them into side lying on the unaffected ear. So in this case, if the left ear is the issue for the patient, we're going to have them quickly go into side lying on their right side. So we're going to just have you laying sideways, okay, on this side. So go ahead, bring the feet up. So you're going to have the patient maintain their gaze on your nose again, looking for nystagmus. Usually it takes 5 to 20 seconds for the nystagmus and shouldn't last longer than 60 seconds. And then you're going to hold this position for about a minute. Then once a minute is over, we're going to rotate the head downwards 45 degrees. And we're going to maintain this position for about 1 to 2 minutes. So after the 1 to 2 minutes, we're going to have the patient sit up while maintaining the 45 degrees of rotation. And then we can go ahead and bring the patient back to neutral.